How to do correct wording regarding an estimate. One thing I have been asked time and again from offices is how do you make sure the patient understands that the treatment plan is strictly an estimate? So many offices struggle with presenting a treatment plan and feeling confident in their explanation. Again, you first have to begin with feeling confident that your insurance breakdown in your computer is as up to date as possible. This allows you to feel confident that you have done as much as humanly possible to get that fee correct. The next step is your discussion with your patient. I usually would begin by reviewing what the doctor and the hygienist have recommended for work. Make sure that the patient is very clear on the work to be done before you begin the financial discussion. I then have found it useful to show them the estimate, but have the insurance portion along with their portion covered up, meaning they're seeing the full cost before you discuss anything else. The best verbiage I ever learned was this: Mrs. Jones, regardless of what your insurance will cover, do you still plan to move forward with this work? This will help you to understand your patient if they are one that is only going to get done what is covered from the insurance, or if they're going to do this work regardless of what is covered. It then is your job to figure out how to make it fit into their budget. I would then proceed to review what we have estimated from the insurance to pay and what they are expected to pay. During this part of the discussion, I make sure to say the word estimated quite a bit. I always make sure to let them know the time we have taken to be as accurate as possible. This provides a level of understanding that you are doing your best to know and understand their insurance. At the end, whether they agree to the work or not, I like to have them sign that we have reviewed the work and the cost. At the bottom of my financial statement agreement, it says this: insurance coverage is only an estimate. Guarantor is responsible for all treatment not covered by insurance. I have in some offices that I've actually highlighted this in front of the patient so that they really, really read it and understand it. By taking this kind of time with the patient and being this clear, you're doing your very best. And when there is a problem or the time that you do get it wrong, the patients are much less upset with you because they understand you have done all you can to get this accurate and to explain it to them also.